Hello and welcome back to Aging Well, a monthly production of Somerville-Cambridge Elder Services. I'm your host, Nathan Lamb, and our topic today is opioids and older adults. And to join us in that discussion today, I have a couple of really qualified experts who are doing good work in this area in the community, and we'll introduce yourselves to our viewers.
Hi, I'm Cassie. I am a social worker at Somerville-Cambridge Elder Services.
Hi, I'm Libby Shrobe. I work at the Institute for Health and Recovery on a project called POWER, which is specifically focused on opioid use and misuse in older women.
Excellent. Well, welcome to the show.
Thanks.
And I guess a good place to start is sort of perceptions. The perception that opioid abuse might be a primarily younger person problem or exclusively for younger people.
Mm-hmm.
Can we talk a little bit about how maybe that's a misconception?
Sure.
Yeah, sure. Go ahead.
I think, yeah, absolutely. A lot of people think it is a problem that affects mostly younger people, but in actuality, the majority of prescriptions with abuse potential are prescribed to older adults. And the statistics are pretty sobering. I think there were 86 deaths reported of people over 55 in 2017 from January to June. And it's approximately 1 in 7 overdoses are people over 55 plus.
Mm. The 87 number, is that in the state?
86, sorry.
Oh, 86, pardon me. Okay.
Yeah, it's in Massachusetts.
In the state of Massachusetts, right?
Yeah. And I think what we're seeing is the opioid crisis in our country does affect young people, but it doesn't exclusively affect young people. And I think that's really the misconception, that there are many older adults who are misusing opioids and at risk for overdose and death in extreme circumstances. And so, you know, though younger people get the primary media attention and treatment focus, there really should be more attention on sort of the 55 and up crowd, because like Cassie said, the majority of prescriptions that have misuse potential are in that age group. And of prescription medications that are misused, opioids are the highest prescription misused.
Well, the good news is it sounds like you're part of the solution in helping to bring some increased awareness to this issue. Can you tell me a little bit about POWER and what you guys are doing?
So that's the goal through this project, is to help raise awareness around this issue. So we are funded through a grant through the Office on Women's Health, which has put out a report last year around the effects that opioids have specifically on women, and they identified some underserved subpopulations, including older women. And so IHR, through our project POWER, is really hoping to do some prevention work around this in Cambridge and Somerville, primarily through training folks who work with older adults, as well as doing some prevention awareness and education to older women themselves. And so really we want to talk about the unique risk factors that older women have in this issue. Older women have an increased risk of chronic pain, and you know, obviously a lot of chronic pain is treated with opioids. And older women are also have changes physiologically in their body that affect the dosing of opioids. And so it's really important for education around how to be appropriately using your medications if you are prescribed opioids, so you don't have increased toxicity levels and such. And I think, you know, something that's an important thing to also bring up here is opioids have gotten a bad rap in the last, decade, because there has been this emerging crisis, and it is obviously an issue. And I think particularly in older adults who have chronic pain, opioids can be really useful, but it's about how you're managing them and that you're doing it safely and under the care of your doctor, so you're not putting yourself at risk for misuse or abuse.
Absolutely.
Yeah.
One quick follow-up on that. In terms of when you speak to the service providers,
Sure.
such as Somerville-Cambridge Elder Services, what are some of the key takeaways that you try to give them when discussing how to maybe help or be aware of this issue?
So one thing that we are working with folks on is instituting more of a universal screening process, because like Cassie said, folks don't normally think of older adults as the primary people misusing opiates or substances in general. So instituting a universal screening process for substance use really will help catch all those people who might be flying under the radar, who you wouldn't necessarily assume are using, drugs illegally. And so one thing we're trying to work on is, instituting that screening method to help catch all of these folks, because also from, coroner's reports and stuff, the autopsies might not show that opioids were the primary, cause of death. So some studies say that the rates of death from opioids in older adults might be even higher because it wasn't diagnosed and then is not diagnosed in the autopsy. So the screening, and then I think really the weighing of the risks and benefits is another thing we want staff to be aware of, is that there are risks, and it's really important to be educated around them and to be educating the clients you're working with so they are on the lookout for signs and symptoms of potential misuse, and then having an awareness of the treatment options available in the area.
That's great. And it's my understanding that you have some familiarity with this issue as well from your work at the agency. Can you tell us a little bit about?
Sure. As a former protective services worker and current mental health social worker, it's an issue I've seen increase a lot in my 9 years at the agency. And that observation is reflected in statistics that show consistently higher rates of substance use among kind of the baby boomer generation than the older cohorts. And I guess we'll get into kind of resources in the community more, but it's certainly a growing issue.
Absolutely. And in terms of your interaction with people, do you normally come into contact with them because they're having issues in other aspects of their lives? How do they generally come to be in contact with you while dealing with this issue in a general sense?
Sure. Yeah, our program, Connect at Somerville-Cambridge Elder Services, it's a pretty small program. We're one of very few ASAPs that offer in-home mental health counseling. So our capacity is somewhat limited. We often get referrals from protective services, people that are coming back in the program because they need a little more ongoing support.
Oh, that's excellent. And we will touch on protective services later in the show. One other note before we wrap up the first segment. You do a fantastic job in Connect by all accounts. And I know you're very modest, but I do want to give you credit. I think it's a great program from what little I know of it. And I think you do a great job there. So it's
well,
really
thanks.
awesome.
Yeah, we're really lucky that our agency is able to offer this program. Yeah.
Absolutely. Well, that's all for this segment. We'll be right back with some more Aging Well.